The peak of BA2 cases has passed, and the current wave is receding. That's good news, especially for the people working in our healthcare system.
Minister of Health Jason Copping and Dr. Dina Hinshaw providing the weekly update on COVID-19, saying it looks like the worst is behind us. The data from Tuesday, May 17th to Monday, May 23rd. The average case positivity rate was about 17.9%, down from about 20% last week. Copping also said levels of COVID-19 in wastewater across the province are trending down. There are 1,040 people with COVID-19 in hospital and 31 in ICU, both down from the previous week. 55 new deaths were also reported. Hinshaw noting some new variants of COVID-19 are being watched right now.
2 emerging subvariants of Omicron have been receiving attention internationally, BA4 and BA5. Both of these have been identified in several other countries around the world. Available evidence suggests these subvariants are more transmissible than earlier versions, which means they can spread more easily once they're in a community. That said, at this time, neither of these subvariants appear to cause an increased risk of severe illness. We identified our first case of BA4 this past week through our ongoing surveillance.
And while there is some relief with BA2, there are still high levels of COVID-19 in Calgary and Edmonton, and hospitals are still dealing with high capacities.
It's been a long winter and a long 2 years for our hospitals and EMS, and they're still under real strain. So I emphasize, we're not just waiting for a break from COVID-19. We're adding capacity across the system as fast as AHS can create new positions and hire into them.
He said 19 of those new ambulances will hit the roads this year, 5 in Edmonton and 4 in Calgary by June, and 5 more in each city by September. Moving forward, data will still be provided weekly, but these in-person COVID-19 updates will now happen every 2 weeks.